Planning for healthcare costs in retirement can feel, well, a little overwhelming, right? Especially when you're trying to nail down the actual numbers. So in this explainer, we are cutting through all the noise. We're going to get straight to the point. What is Medicare Part B really going to cost you in 2026? Let's break down every single number you need to know for your budget.
So here's what we've got on tap. We're going to start with the absolute basics of Part B, then jump into the three main costs that pretty much everyone needs to know. After that, we'll get into the interesting part, how higher income can actually change your premium. Then we'll talk about a penalty you definitely want to avoid, and we'll wrap it all up with some practical tips you can use to manage everything. All right, first things first. Let's build a solid foundation here. What exactly is Medicare Part B, and why is it so crucial for your healthcare plan? This is the big question, isn't it? It's the one that can make or break a retirement budget. Getting a crystal clear answer is the key to making sure there are no nasty financial surprises waiting for you down the road. So let's get into it.
To put it simply, Part B is basically your day-to-day medical insurance, for everything that happens outside of a hospital stay. We're talking about your regular doctor visits, outpatient tests, things like walkers or oxygen tanks, and even preventative care to keep you healthy. It is an absolutely essential piece of the puzzle.
Okay, now for the part you've been waiting for, the numbers. For most people, your total Part B cost is made up of three main pieces. Let's take a look at each one.
Your first cost is the monthly premium. The easiest way to think about this is like a subscription fee you pay every month just to keep your insurance active. And hey, if you're already getting Social Security benefits, this amount is usually just taken out automatically. Super simple.
So for 2026, the standard monthly premium is set at $202.90. Now this is the baseline number for most folks, but I want you to file this away. This isn't necessarily the final number for everyone, and we'll see why in just a little bit.
The second cost you need to know about is your annual deductible. This is the amount you have to pay yourself for your medical services at the beginning of each year. Think of it like a starting line you have to cross before Medicare says, okay, tag me in, and starts sharing the costs with you.
And for 2026, that annual deductible is $283. So you'll pay that amount out of your own pocket for services at the start of the year, and then Medicare starts to help out.
And that leads us perfectly into our third main cost, which is coinsurance. See, once you've paid that $283 deductible for the year, you're not on the hook for the full cost of your care anymore. From that point on, you and Medicare basically share the bill.
And your share is typically 20%. That's the magic number. For most approved services, whether it's a visit to a specialist or you need some medical equipment, you'll cover 20% of the cost, and Medicare picks up the other 80%.
This 80-20 split is really the key to the whole thing. Once you've met that deductible, every single approved medical bill gets divided up this way for the rest of the year. It's this partnership that really makes your healthcare costs much more predictable.
Okay, remember how I said that $202.90 wasn't the final number for everyone? Well, this is why. It all comes down to income. If you earn over a certain amount, you'll actually pay an extra fee on top of your premium. It has a fancy name, the Income-Related Monthly Adjustment Amount, or IRMAA for short.
So what is IRMAA? It's basically a surcharge. It's an extra amount that higher income folks pay for their Part B coverage. The logic is pretty simple. The more you earn, the higher your total monthly premium is going to be.
Now here's probably the trickiest part about IRMAA, and it trips a lot of people up. It's the 2-year look-back. See, Medicare doesn't use your income from this year. To set your premium for 2026, they're actually going to look at the income you reported on your 2024 tax return. This is such a critical detail to remember when you're planning your finances.
This chart lays it all out perfectly. Just find your 2024 income on the left side, and you'll see your total monthly premium for 2026 on the right. So for example, if you're an individual who earned, say, $140,000 back in 2024, well, your premium jumps from that standard rate all the way up to $405.80 a month. As you can see, that difference can be pretty significant.
Okay, next up is a cost that has nothing to do with your income and everything to do with your timing. I'm talking about the late enrollment penalty. And believe me, getting this one wrong can be a very, very expensive mistake that follows you for the rest of your life. And this is the part that everyone needs to hear loud and clear. Unlike other fees, this penalty is not a one-time thing. If you get hit with it, that extra amount is tacked onto your premium every single month for as long as you have Part B. It literally never goes away.
So how does this nasty penalty work? Well, for every full 12-month period that you were eligible for Part B, but you didn't sign up and you didn't have other qualifying health coverage, like from a job, your monthly premium goes up by 10%. So if you wait 2 years, that's a 20% penalty added to your premium. Forever.
Okay, wow. We've talked about the premiums, the deductibles, those income adjustments, and the penalties. But now for the good news. Let's pivot and look at some practical, proactive things you can actually do to manage these costs and really take control of your healthcare budget.
Think of this as your power checklist. First, and I cannot say this enough, sign up on time. Avoid that lifetime penalty at all costs. Second, if your income is anywhere close to one of those IRMAA cliffs, talking to a financial pro could save you a ton of money. Third, always make sure your doctors accept Medicare. And finally, if you have a limited income, please look into Medicare savings programs. They exist specifically to help with these costs.
So there you have it. We've laid out all the key numbers for 2026, from that $202.90 standard premium all the way to the income adjustments and penalties that can really change your bottom line. You have the information now. The only question left is, what's your next step going to be to get prepared?